Hi, my name is Emily. I'm a family nurse practitioner student, and I'm here today to do an abdominal assessment. Okay. I'm going to begin by moving your shirt up to the level of your breast there. And I'm going to begin by visualizing your abdomen. I'm visualizing for any scars, lesions, striae, any peristalsis or aortic pulsations that I can visualize. I'm looking to see if your abdomen is symmetrical, if this side of your umbilicus is the same size and shape as the left side of your umbilicus. I'm also looking at the area of your umbilicus to make sure there's no inflammation or indications of hernia, which there is not. I'm going to begin by listening to your bowel sounds. I'm going to warm up my stethoscope in my hands so you're not shocked by the coldness of my hands. I'm going to listen to the bowel sounds in all four quadrants of your abdomen. Let's get my stethoscope on correctly here. Okay, I'm going to lightly lay my stethoscope on your abdomen. Okay, your bowel sounds are active in all four quadrants, not hypo or hyper, just active, which is good. Now I'm going to listen for bruits over your aorta, your renal arteries, your iliac arteries, and your femoral arteries. Okay, I'm going to do that with the bell of my stethoscope. I'm going to start by listening over your aorta, if you don't mind moving your hands up there. Listening for any bruits or whooshing. Okay, now I'm going to move down to your renal arteries. Okay, no bruits bilaterally. And your iliac artery. And lastly, your femoral. Okay, no whooshing or bruits auscultated on any of your arteries. I'm going to begin now by percussing on all 9 areas of your abdomen. I should hear dullness over the liver, which is in your right upper quadrant, and tympany over your spleen, which is in your right upper quadrant. So I'm going to start by percussing over your liver. Okay, dullness was heard over your liver and tympany heard over your spleen. Now I'm going to measure the span of your liver, and I'm going to do that by starting right underneath of your nipple line and percussing downward until I hear the dullness of the top edge of your liver. Okay, let me grab my pen so I have that available and my measuring tape. Okay. Okay, I hear dullness right here. I'm going to mark it with my pen. And I'm going to now move down to your umbilicus and palpate or percuss upwards until I hear the lower edge of your liver with the dullness. Okay, right there. And I'm going to measure that in centimeters. and that is about 5 centimeters, which is normal. 6 to 12 is normal, so you do not have an enlarged liver. Now I'm going to test for splenomegaly, and I'm going to do that by percussing on the left side of your where your spleen is, and I'm going to have you take a deep breath in and hold. When I tell you to take a deep breath in and hold it, and the tympani should remain the same. Okay, go ahead and take a deep breath in and hold it. Okay, the tympani remains the same. Now I'm going to begin by palpating lightly on your abdomen in all 9 quadrants. Is there any pain as I palpate? Okay, now I'm going to do some deeper palpation. I'm palpating for any masses, lumps, nodules. Any pain as I palpate these regions? Okay. Now I'm going to palpate your liver by pressing upward with my left hand and palpating downward at the where I measured your liver span to be. Take a deep breath in as I palpate. Okay. Now I'm going to attempt to palpate your spleen. I'm going to bring my left hand underneath, and I'm going to have you take a deep breath in as I palpate for the edge of your spleen. Okay. Now I'm going to palpate for your kidneys. I'm going to come mid-clavicular from where I measured your liver at. I'm going to switch my hands, left hand underneath, right hand on top. Go ahead and take a nice deep breath in and out. I'm trying to feel the kidney as it comes back down. I'm going to do that the same way on the other side. I'm going to come around to this side. Okay, go ahead and take a nice deep breath in and out. Okay. I did not palpate the kidney, but that's not abnormal. Now I'm going to measure your aortic width. I'm going to palpate where I feel your aortic pulse. Okay, mark that spot there, and then where I stop feeling it. Okay, there's my spot. I'm going to measure that distance. And it is 3 centimeters, which is a normal reading. I'm going to conduct several special tests to test for ascites, which is a fluid buildup in your abdomen. And the first thing that I'm going to do is, I'm going to assess for rebound tenderness first. I'm going to press down on your abdomen and then bring it up abruptly, and you let me know if you have any pain, okay? Any pain? Okay. I'm going to test for ascites, and I'm going to do that by